Okay. Our next speaker is Dr. Francis from Saudi Arabia, and he's going to talk about fetal nucleated red blood cells based on early prenatal identification.
Very good morning, ladies and gentlemen. I'm very happy to be here, and thank you for the organizers for selecting our abstract and inviting us to present our abstract also. As all of you know that the genetic diseases are more prevalent in the Middle East in general, but the thing is, like, even though the premarital screening is there, still 98% of the couple, they are not ready to withdraw their marriage. Instead, they are continuing their marriage. The burden of the prevalence is increasing, keep on increasing. And in the case of Saudi Arabia, they have a very peculiar system for identifying the disease. If it is identified early, then they will be able to go for further proceedings related with the termination of pregnancy. So what is our goal was, as all of you are very much aware that the amniotic fluid or ultrasound, all these things are the gold standard technologies, but these technologies will not be able to give you the answer before 120 days of the pregnancy. So what we have taken is, we have taken the initiative in order to identify the genetic diseases using the fetal nucleated RBCs from the mother and the cffDNA from the mother's blood. Along with the one more sample that is called coelomic DNA. This sample is one of the peculiar sample which you can collect as early as possible from the pregnant mother. So in order to get our things done, we have started our proceedings since 2017. We have been in communication with the ethical committee in order to get the approval, as the samples are supposed to be collected in the during the time of early pregnancy, and it is have little risk for the few samples. The one sample is the coelomic fluid. So after 1 year of our communication and the discussion with the ethical committee, we finally got the ethical approval for this study. Then we have taken immediately the study to collect various samples from the mother, starting from the coelomic fluid, collecting the blood and urine. Everywhere we are trying to locate where we can pick the cffDNA and where we can pick maximum number of fetal nucleated RBCs. So for this study, we have really very happy and fortunate to have families, those who have come forward to give their samples in order to proceed, because most of the time we don't get the support from the father. That is the case in most of our studies, but we have taken initiative to collect the sample from the fathers also. That is also really happy that they have given chance. And we are the first institute in our university hospital. We have collected the coelomic fluid in the Middle East region. And we have, after collecting the blood from the mother, we try to retrieve the fetal nucleated RBCs using various techniques. Specifically, we have developed one technique in order to pick the fetal nucleated RBCs by combining the magnetic beads and Percol gradient. This is the technique what we developed, and this technique is already in the patent. You can see that there is a difference between the mother's blood and the control, which is the father blood. You can see the fetal nucleated RBC, which is already picked with our methodology. And here we have some of the results, and all the fetal nucleated RBCs are larger than the normal RBCs. That is what we have observed in our study. And we have developed, with this selected nucleated RBCs, we have developed the assays in order to identify whether we are really picking the nucleated RBCs from the origin from the baby. That we did with the Y chromosome checking, because when we are completing the study, by birth we are confirming whether the baby is male or female. If it is male, then we are proceeding, we are considering those the results for our validation process. And later we have developed one direct PCR methodologies in order to go for the fetal nucleated RBCs can be subjected immediately for the PCR without the DNA extraction. This protocol is also under the patent disclosure. So altogether, all these methodologies we have adapted for one of our the mutation what we have identified in the recurrent pregnancy loss, which was published last year, and we developed the methodology to detect the variant at 5th week of pregnancy, and we were able to achieve that one also. And at the end, I would like to conclude only one thing, that the early identification is better with the fetal nucleated RBCs rather than the cffDNA. So this technology definitely will go for the early diagnosis in the field of genetic diseases. And really, thank you for all my students, my PhD students, my master students, and many students. They were really involved for the last 5 years with us in order to complete all these development of various protocols. Thank you so much. Thank you. Okay, thank you, sir.
Okay, next speaker